everyone. I have another healthcare related video to share with you today. This is, it's actually more of a podcast because we don't have video for most of it. But today I'm going to be talking with Dr. Bob Calhoun, and he's going to tell us more about why it is that vitamin D and zinc work together to help fight viruses. And he also shares a few other things that he's learned on specifically how to prevent viruses and talks about the coronavirus or COVID-19 specifically a little bit. Now, Dr. Bob has been helping me for about a year now, and he is the one that first told me about vitamin D and zinc and has been helping me with preventative health care so that I can prevent myself from getting sick and I don't have to deal with all of those things. And this has drastically improved my life. So I hope that you can find some information useful in here and have an enjoyable time, and then implement some of these things in your life maybe so that you can maybe have some peace of mind and also some greater health. So enjoy. I am so excited to finally be talking to you on the phone about this. Thank you so much for agreeing to do this because I think the information will really help everybody.
Thank
So
you for
first of
having me.
all, before we get started, can you tell everybody about you and about your practice? What do you think they should know?
Okay, well, my name is Dr. Bob Calhoun, and I'm a family medicine board certified physician. I did my medical training at American University of the Caribbean in St. Martin. I did my clinical study in the UK, in Staten Island, and in Detroit, and several places around Louisiana. I did my residency at EA Conway Hospital in Monroe, and I I served for 4 years in the United States Air Force at Little Rock Air Force Base in their family medicine clinic. I was the senior clinician there for a couple of years. Um, I came home as quick as I could, and I got back home and started a direct primary care practice. Now, direct primary care is a growing model of subscription-based medicine. Basically, we take all of the problems that come in with insurance and co-pays and deductibles, and we throw all that out the window because I cut out the middleman. My relationship is directly between me and my patients. My patients pay me a retainer fee on a monthly basis or on an annual basis, and they can call me or text me or see me whenever they want, as long as they want, as often as they want. There's no limitations. That's it. You know, it seems like it shouldn't be that simple, but it really is.
I know, and that kind of sounds amazing. It's almost like going back into the past, the way that doctors used to operate. And now you're here, and so you're serving the Monroe area and the West Monroe area.
Right. My goal is to try to bring um, cutting edge medicine with the help of modern technology um, to this area with an old fashioned feel. You know, I do house calls, I do business calls. I I've done 8 house calls in the last 2 months,
Wow,
and
that is so amazing. That's
right.
awesome.
That's the whole point. I want to be able to give people an idea of what it looks like when you have a relationship with your doctor. I sort of base my model on this relationship driven medicine rather than volume driven medicine. Because I think that people get better health outcomes when they know that they have somebody that they can always call when they've got questions. You know, you're at a store and you're looking at this supplement, you want to know about it, snap a picture of it, send it to me. You know, you've got somebody in the house with this or that symptom, and you want to know whether or not you need to go to the ER or just tough it out, or whether there's something you can do at home. Call me up. Worst case scenario, I meet you at your place, or you meet me at my office, or I tell you that yes, you really should go to the hospital.
All right. Now, what type of people usually benefit from this type of service? It sounds like it would be beneficial to a lot of people, but what are the type of clients that you normally see?
The people that I structured my model around are, and sort of my ideal patient would be someone who is interested in experiencing a different kind of medical relationship than you get in a standard big box assembly line clinic, who sort of wants to be healthy, whether they are or not. That's okay. I'm very comfortable with all levels of health. I mean, I've treated everything from end stage everything to very healthy people, and I'm comfortable with all that. But my ideal patient wants to be healthy and is willing to think differently about their health to get there.
Oh,
I think that the best kind of person would be that, but also people that are tired of paying really high deductibles. You know, people that got priced out of the market when Obamacare raised everybody's premiums. You know, a lot of people that are really getting crushed on their regular health care insurance would save a lot of money by dropping their plan back to a high deductible, low premium plan and rolling the savings into a subscription with me and then a health savings account to make up the difference.
right. And that makes it very doable. But also, what about people who have more chronic or ongoing conditions, things that they need regular follow-up for to try to overcome? Do you work with people who are trying to do like maybe lifestyle changes too?
Absolutely. That's the dead center of my wheelhouse. People that have chronic conditions like diabetes, high blood pressure, people that are overweight and want to lose weight, all of those people are very, very much in my wheelhouse. And I do very well with trying to help those kind of people because you don't have to save up your illness and your time and your money to take off work, go halfway across town. Um, spend half a day in your doctor's office with all the other sick people in the waiting room to get a 5-minute visit with your doctor who's telling you your blood sugar is still too high, cut out the sweets. You can call me on the phone and say my A1C was 6.5 this week. What do you think we ought to do? And I can sit with you on the phone and talk with you about what's going on in real time. We don't have to wait on it. More frequent and smaller checkups means that you get more sort of real-time course correction on what you're doing. And I think the outcomes are going to be better that way.
Yeah, so that could be really beneficial to a lot of people. And right now, I think word of mouth is really how you find out about opportunities like this to see someone like you. And I first heard about your practice from a friend, and you were the first person actually that told me about vitamin D and zinc together and taking vitamin D and zinc when
Hmm.
you start to get sick.
Right.
And I had never really heard that. I
Hmm.
had always heard take vitamin C. So I was kind of even a little skeptical when you first told me that. But I was like, okay, I'm going to try it because, vitamin C is not working on its
Uh-huh.
own. So I actually, did that. And when I first started to feel sick, that's what I would take. And it
Hmm.
has worked. Now, I really wanted
Fantastic.
to talk to you about, to try to get you to explain why that works.
Okay. So, Queen Mary University in London did a study, I think it was back in 2017, and I think they followed over 1,000 patients to try and figure out what the optimum dosage was, when they should start taking it, that kind of stuff for vitamin D, and how it affected people with upper respiratory infections and the flu. And so what they found was that a lot of people are chronically deficient in vitamin D, and so they tend to have more severe symptoms with both upper respiratory infections and the flu. And that, in fact, for every 4 milligrams per deciliter increase in your vitamin D concentration, you lower your odds of getting the flu by 7%. So, what they found was that there's a benefit to chronic supplementation of vitamin D just to make sure that your levels are your standard, going forth levels are high enough. I'd say over 45 is where you want to be, because you'd have to guzzle vitamin D to get it to anywhere close to a toxic level. I mean, there's no established toxic
Hmm.
level by the FDA as far as daily supplementation. Um, but they found that the symptoms of upper respiratory infections um, generally have a significant reduction qualitatively when people are not deficient. And in people who are deficient, acute supplementation at the first sign of cold symptoms reduces both the intensity and the duration of symptoms. Um,
Right.
the way that it works is by so your so vitamin D, people think of it as a vitamin, but it's actually a hormone, and your body makes it on its own. It part of it's processed in the liver, and part of it's sorry, not the liver, the kidneys, and part of it's processed in the skin. That's why they say vitamin D. You need sunlight for vitamin D. That's partially true because sunlight activates vitamin D2 into vitamin D3.
Oh,
Yeah. And so vitamin D, actually, your immune system has vitamin D receptors on the cell surfaces. It's specifically in your your native immune system. It's the sort of intrinsic immune system, the first line defenders, the innate branch. And the more vitamin D receptors are filled up and ready to go, the faster your immune system works to eliminate things like viruses in the system before they can take hold.
this is amazing. This is so cool. I had no idea about any of this. So
Yeah,
that explains vitamin D then. So it's
right,
your body's first line of defense in your skin, and it becomes active there. And if you have enough,
right,
so if you have enough and you're taking supplements to kind of boost that level to make sure you have enough, then you're more likely to zap anything, any kind of invaders that come in immediately instead of letting them, take hold and grow and
right,
eventually get to the point where you have to go in, sit in a doctor's office and be sick and get some other kind of medication for it or antibiotics
right,
for secondary infections or illnesses. Where if you have this in your system, then that protects you before any of that happens. That's amazing. Okay,
right.
so what about zinc? How does
Okay.
zinc work?
So zinc does a couple of things. Zinc binds to the same part of the cell that rhinoviruses use to enter the cell. Now, rhinovirus is one of the two major types of virus that causes common cold symptoms. The other being, oddly enough, coronaviruses. Um,
Mhm.
though, I've been talking about coronaviruses forever. We all have as physicians, but not in this sense. But zinc actually binds to the cell surface at the same place. It competes with the virus for entry into the cell. It's basically like you've got somebody trying to break into your house and you bar the door. Um,
Mm, mhm.
so if you do it early, they don't get in. And even if you do it a little bit after they've got in, it may keep their friends from getting in.
Right, right.
So the other way that zinc works is that it inhibits viral replication. So if we talk about the whole house invasion thing, the the zinc, even if you know sort of you can't prevent one from getting in, you don't have more people getting into your house. So you're better able to fight off what you do have. Um, so those two things really help reduce the symptoms and duration of the common cold. It's best if you start taking it within the first 24 hours.
Mhm. Right. That would make sense. So
Hmm.
right when you feel like you just feel a little bit off, you
Yeah.
don't know if you're getting sick or not,
You
just
keep some
start
on
taking these
hand.
things anyway.
Right.
Right. Yeah.
You keep some on hand. And daily supplementation, not a bad thing.
Yeah.
especially during cold season.
Yeah. So you can go ahead and take vitamin D and zinc on a regular basis.
Hmm.
And then if you do start to get sick, you just take more of it. Is that
Right.
right?
Yeah.
Okay.
Now,
Can you tell us?
go ahead.
Mhm. No, go ahead.
There was a study that showed that in people who had been supplementing with zinc for 5 months or longer, there was, I think, a 25 to 30% reduction in sick days taken from school-age children. So that was a pretty interesting study.
Yeah. Yeah. So there is research that backs this up where it's
Absolutely.
been tested and doctors, I have access to this information, know it works. But again, like I said, I had never heard this.
Hmm.
I don't believe I'd had any doctor ever prescribe these things as the treatment, right?
Right.
Do you think that's just because we wait too late or because this is just not the first avenue that doctors usually take
Well,
when treating patients?
I think there are a few factors in it. I think that most of the time, if you're not bleeding, dying, or having difficulty functioning, most people aren't really willing to take time out of their life to go to a doctor because it's just inconvenient and it's expensive and it's time consuming and you have to sit in a room full of all kinds of other sick people and the whole experience is just kind of unpleasant. So people don't do it until they really have exhausted their options at home. And at that point, zinc isn't really effective anymore.
Hmm.
Um, and the other thing is, by the time you're feeling that bad, you just want something that's going to make your symptoms feel better. Zinc doesn't really do that in the short term. What it does is it prevents you from getting bad in the first place. When you
Right.
get sick, you want a pill for your ill. So they're talking, I want some antibiotics, I want a steroid pack, I want that Rocephin shot, and okay, I get it. But it's better to prevent than to treat. But when you have 7.5 minutes for your average primary care visit to talk with your patient, that's a lot of sugar for a dime to fit into that amount of time. You have to meet your patient, you know, figure out what's wrong, establish rapport, figure out how to explain what your plan is to them, and then sort of, that doesn't all really fit sometimes. So a lot of times they'll have a standard sort of treat and street regimen that they get for, your this constellation of symptoms. And it may not work for everybody, but 85% of the people, that's pretty good odds for, 5, 7 minutes of medicine. And
Right. So
good
this
enough
is
medicine is sort of the order of the day these days in big box assembly
yeah, and
clinics.
we're talking about preventative medicine, which is
Right.
what you really need, and nobody goes to the doctor for, "Oh, I'm not sick yet. I'm just
Right.
gonna come in and talk to you because I'm not sick."
Right.
Right. Yeah.
That's what I
Yeah.
want to change. I
Yeah.
want to change that by getting people to have a closer relationship with their doctor so that they don't get sick in the first place.
Yeah, and they're able to do that, especially I could just imagine if you had your doctor's cell phone number, that's amazing.
Right.
And that's how you operate on a normal basis, and
Every day.
it's very cool, very cool.
Yeah, thank you.
Okay, so what about, do you have any dosage guidelines or anything like that you can share?
I do.
Is this okay?
So the most absorbable form of zinc is in a lozenge or in a melt or in a spray, the zinc gluconate. And what I use myself is the melts from Zicam or the spray from Zicam or the store brand is just fine for all of that. For the acute phase, what you want is 13 to 23 milligrams every 2 to 3 hours. Now, for a maintenance dose, there's no consensus on how much you should take. Um,
So
there,
that's your
those
daily dose, right?
right
So there's
daily
no
doses.
consensus
I
on
mean, right now with the coronavirus studies, they're dosing at 220 milligrams a day, and that's fine. You don't want to take too much zinc because you can have some side effects like nausea is something that happens when you really dose zinc very high. And also, there's been incidences of anosmia, which is difficulty or reduction or elimination of the sense of smell. And that actually was a significant problem. People may remember when they had zinc swabs from Zicam, the nasal swabs. Now they have a homeopathic preparation of nasal swabs from Zicam, and that's not the same thing. But they used to do zinc swabs, and that was a very effective way of absorbing zinc because the mucosa, the inside of your mouth, the inside of your nose, that's where zinc is most readily absorbed. So getting it in your nose and nothing gets swallowed and you don't have all your saliva washing it down your throat, it stays there for a long time. But the problem is it also damages the olfactory nerves a little bit when it's that close to them. And so they had to take that off the market. So you don't want to do too much zinc. Now,
Okay, but when you do
Mhm.
when you take like a lozenge or something,
Yeah,
you said it needs time to absorb. So
right.
don't eat or drink anything afterwards.
Right, 15 minutes should be enough. With the melts, I generally will put one in my mouth, just let it dissolve as slowly and naturally as you can, and just don't go and like rinse your mouth out or drink something really fast or something after that. I don't think it's, a precise science, but, give your mouth a chance to absorb everything it can. If you're really thirsty, don't like hold off, and it's better to kind of drink. But if you can wait 15 minutes, it's not a bad idea.
Mhm.
Now for
Okay,
vitamin
so
D.
that's for dose. Yeah, for vitamin D. What is the dosage on that?
Okay, so vitamin D, there's a vitamin D council, and they suggest dosages between 5,000 and 10,000 international units a day, and that is body weight dependent. Um, I generally fall somewhere in the middle of that, and I recommend people take between 7 and 8,000. It's whatever dosage you can find that's convenient and easy for you to take.
And that's
In
for
my,
an adult.
for an adult, anybody over 125 pounds, I'd say.
Okay. All right.
Um, and what I do personally is I have a high potency drop. It's a flavorless, colorless liquid. Um, there's several different vendors that sell them. Pure Encapsulations has one. Zymogen is the one that I use. And I just use drops. It doesn't taste like anything. You can put it in something. I mean, heck, you can just get your kids to stick out their tongue. For kids, you should take 1,000 international units daily per 25 pounds of body weight. So your kid weighs 100 pounds, that's 4,000 units a day.
Okay. All right. And that's the maintenance dose, right?
Yeah, now acute dosing, I recommend 20 to 30,000 units a day for 3 days.
And is that's for an adult?
That would be for an adult. For a
Oh,
child, I'd say you're probably going to do half that, 10 to 20,000 units a day, or 10 to 15,000 units a day.
okay, depending on the size of your child.
Right.
All right, that's great. And so this is helping prevent just normal everyday viruses. What about the coronavirus? Does it help with that in any way?
Actually, it does. Zinc is part of the most effective regimen that's being used to treat SARS-CoV-2, which is the virus that causes COVID-19. There's some research out of Marseille, France, that shows that dosing of hydroxychloroquine plus zinc at 220 milligrams is inhibiting viral replication in the cells. And when they use that in conjunction with azithromycin, the azithromycin is suppressing what's called a cytokine storm. It's an overreaction of a chemical cascade set up by your immune system, and azithromycin has an anti-inflammatory effect that suppresses that response.
Okay, so you said azithromycin, and what is that exactly?
That's your ZPak.
Just a Z-Pak.
Yeah.
Okay.
And it's at the
And
ZPak doses too. Um, Now, hydroxychloroquine is a medicine that's been used for 40 years um, for people with lupus and rheumatoid arthritis and a few other autoimmune conditions for a very long time. It's also an old anti-malaria medication, which is, I think, one of the reasons that you're not seeing outbreaks of COVID-19 in places where malaria is endemic because a lot of people are on hydroxychloroquine or doxycycline, some of the anti-malarial medications.
oh, okay. They're already taking it. So,
Right.
okay. All right, that's a really good insight there. Thank
Mhm.
you for that.
Sure.
Um, so if someone would, wants to talk more about this with you,
Mhm.
maybe um, just get a call, introductory call, or reach
Sure.
out to you in some way to learn more, what is the best way that they can do that?
I have a website. It's drbobcalhoun.com, D-R-B-O-B Calhoun, Calhoun.com. And I regularly update that with my contact information. I have a cell phone number. Don't plan on changing it soon. It's 318-816-9055. And I regularly update my website to reflect what I'm doing. I have enrollment buttons all over the place, so if you want to sign up, you can do that there. But I really like to talk to people on the phone. I want to get a sense of who you are and what you need. Because I've had people call me and, they tell me their situation, and I'm not the right doctor for them. Either their case is just too complicated or um, there's some other thing that makes them just not an ideal patient for me. I don't mind telling them, look, this is not the right model for you. You need to go somewhere else. But I'll try to give them what advice I can before I let them go.
All right, that is so nice, so awesome to have that in a doctor.
Well, thank you.
And thank you for taking the time to share all of this with everybody. I'm sure that people are going to find this so valuable. And I'll link it to everything you said and try to get that information in there with the names and the spelling so people can look this up themselves and
Great.
post your information so that they can get in touch with you. So I hope that everyone else found this as valuable as I did. I learned a lot. So thank you so much.
Well, thank you for giving me the opportunity. I really appreciate it.